Jehovah's Witnesses, alarming results in Zurich study. Former Jehovah's Witnesses experienced physical and sexual violence in childhood 3 times more often than the general population and emotional neglect or violence 6 times more often. After leaving the group, 77% of former Jehovah's Witnesses are subject to mandatory termination of contact. 1 in 3 people who have left the group have suicidal thoughts after leaving the group, and 10% of those who have left attempt suicide. Former Jehovah's Witnesses are 40% more likely to suffer from chronic illnesses, and a third more likely to suffer from mental illnesses. These are data from a study published in November 2023 by the University of Zurich, here in German translation, on the health and well-being of 424 former Jehovah's Witnesses in German-speaking countries. These alarming figures make clear the need for political action. This was published in English. Characteristics of health and well-being in former Jehovah's Witnesses in Austria, Germany, and Switzerland. Characteristics of health and well-being in former Jehovah's Witnesses in Austria, Germany, and Switzerland. Miriam V. Thomas, Psychopathology and Clinical Intervention, Institute of Psychology, University of Zurich, Zurich, Switzerland, and University Research Priority Program Dynamics of Healthy Aging, University of Zurich, Zurich, Switzerland. Andreas Gorius, Department of Clinical and Health Psychology, Faculty of Psychology, University of Vienna, Vienna, Austria. Shauna L. Rohner, University Research Priority Program Dynamics of Healthy Aging, University of Zurich, Zurich, Switzerland, and Competence Center for Mental Health, Department of Health, OST, University of Applied Sciences of Eastern Switzerland, St. Gallen, Switzerland. Urs M. Nader, Department of Clinical and Health Psychology, Faculty of Psychology, University of Vienna, Vienna, Austria, and University Research Platform The Stress of Life, Soul, Processes and Mechanisms Underlying Everyday Life Stress, Vienna, Austria. Eva Heim, Psychopathology and Clinical Intervention, Institute of Psychology, University of Zurich, Zurich, Switzerland, and Institute of Psychology, University of Lausanne, Lausanne, Switzerland. And Jan Holch, Department of Psychology, University of Hawaii at Manoa, Honolulu, Hawaii, USA, and Resilience Research Center, School of Social Work, Dalhousie University, Halifax, Canada. Abstract. Background: this study collected quantifiable data on the characteristics, health, and well-being of individuals who left or were expelled from a fundamentalist Christian faith community in Austria, Germany, or Switzerland. Methods: data were collected using an online survey. Results: this study assessed a sample of former Jehovah's Witnesses, N equals 424, MAGE equals 42.14, SDAGE equals 12.57, 65% female. Most participants, 66%, were born into this faith community. Half the sample left voluntarily, 21% were expelled, and 31% left due to having experienced abuse or maltreatment. 1/3 reported suicidal thoughts, 10% had attempted suicide. The sample, especially women, reported relatively high levels of child maltreatment, moderate current health, clinically significant symptoms, high levels of stress, and low quality of life. Participants who left due to abuse or maltreatment reported more symptoms and child maltreatment. Discussion: women and survivors of child maltreatment may represent particularly vulnerable subgroups of former Jehovah's Witnesses.